So my presentation today really focused on the use of systemic therapies together with salvage radiotherapy and emerging paradigms in this space to treat patients with biochemical relapse. So I talked about the use of ADT in patients at particularly higher risk biochemical relapse, where there's trial evidence emerging that patients with a PSA of above 0.5 may benefit from a short period of ADT, and a further subgroup might benefit from greater treatment intensification with the use of ADT and an ARPI. This space is rapidly developing, and there's other trials, phase 3 trials coming out in this space in the near future. I also talked about other emerging paradigms, such as that from the EMBARK trial recently, which showed that patients who may not be eligible for salvage radiotherapy may still benefit from the use of ADT with an ARPI on an intermittent basis, though a majority of these patients would go on to go back on their systemic therapy eventually because of PSA rise. And many of them would unfortunately also experience quite significant toxicities associated with the combination of an ADT and ARPI. And then leading on from this, I introduced emerging paradigms in this space, such as the use of perioperative systemic therapies, which mean giving systemic therapies both before and or after surgery in those considered to be at greatest risk of relapse, such as the results coming out from a number of ADT-ARPI trials, which have suggested that though we don't see quite significant pathological complete response, the residual cancer burden may be a good prognostic indicator for the risk of developing metastases in the future. And really, in quite an exciting way, in the next 2 weeks, we hope to hear the first results from the Proteus trial, which is a phase 3 trial in this space. Though perhaps looking further ahead, we know that patients are likely to, they're going to be a subgroup of patients who are likely going to be overtreated, and again, a subgroup of patients who might be undertreated. And really, we're moving towards this space where biomarker-directed strategies might allow us to be a bit more precise and offer biologically directed therapies, such as use of PARP inhibitors, for instance, for patients with BRCA alterations. So I've covered quite a broad spectrum there, and hopefully this was useful for the audience.